my pleasure to welcome you to the Department of Surgery at Indiana University School of Medicine. It's a large department, as departments of surgery go across the United States. About 125 faculty spread across 7 hospitals in the greater metropolitan region. The bulk of these faculty work downtown on the Academic Medical Center campus. They're located in 6 divisions, 6 specialties. The largest of that group would be general surgery and 7 different specialties in general surgery. I think basically in the Department of Surgery at Indiana University, there's something for everyone. For those faculty, for example, interested in educational research, we think that's another thing that makes us unique. We have the largest educational research team of any department of surgery in the United States. A group of faculty and expert researchers and PhD researchers entirely focused on making the medical student and the resident educational experience better.
At IU School of Medicine, and specifically in our Department of Surgery, we have created a really strong educational research team. And the main reason for that is because we believe so much in education and that it needs to be the best possible that we provide to our learners.
Medical student education in the Department of Surgery here at Indiana University is a fantastic experience. The students work, of course, right beside us as faculty. They experience the operating room, they experience the clinical setting. They do simulation also in our very large simulation center. And they, of course, get excellent didactic education from our faculty, really at all levels of the medical student education trajectory.
We take our research mission very seriously. Because of the large clinical volume that allows great opportunities to do clinical research, we've really maximized that opportunity through our Center for Outcomes Research in Surgery, allowing our faculty to be more efficient in their clinical research, providing them with biostatisticians and data analysts and data technicians. And then, of course, our research faculty work in 12 research laboratories across the campus doing some very amazing basic science research.
Surgical research is important within a medical center, not only to train aspiring doctors and scientists in important questions in surgery, but also because surgeons and people who are in a department of surgery bring a different perspective to medical research. The kinds of questions that surgeons ask, the more holistic and integrative look at the human body, I think these are all really important contributions.
CORS is a place where the residents, the medical students, faculty can come with their outcomes or health services research questions, where we try to essentially take them from the inception of the idea all the way through to the publication of their research and every phase in between. So we have the expertise to connect them with the things that they need in order to accomplish that.
Well, clearly our obligation is to clinical care. We see a large number of consults, tertiary, quaternary care coming throughout the state of Indiana from other physician practices. So the clinical volume is clearly very large, and that's a high priority.
We see a huge number of esophageal cancers, consistently always top 5 in terms of volume of esophageal cancer cases in the country. And then also we see a large amount of very complex germ cell tumors, which quite frankly, thanks to Dr. Kessler, my senior partner, people come all around the world to IU specifically for treatment for germ cell tumors.
One of the unique features of the pancreatic cancer program in University Health is that we are able to evaluate a large number of patients by bringing together world-recognized experts in the field of pancreatic cancer. Each patients are reviewed by a multidisciplinary team on a regular, weekly, and sometimes twice-weekly basis, where we're able to offer them state-of-the-art care in a timely fashion. And I think that's what really allows Indiana University to stand out as one of the elite medical schools in the United States.
So what's different about IU compared to other facilities is that IU is an academic center. And so in addition to providing high quality clinical care, a lot of my colleagues have an interest in research. And so we focus on providing innovative ways in terms of treatment and also innovative ways in terms of how we have our patients interact with the healthcare system.
Finally, The Department of Surgery is a remarkable group of surgeons and scientists committed to collective shared values. Values such as innovation in our surgical practice and research, an effort to have a global impact in surgical education, integration into community, the highest levels of professionalism, and a desire to bring integration between our surgical lives and our lives outside of medicine. If you're a medical student looking for a place to do residency, if you're an academic surgeon looking for a faculty home, or a patient in need of surgical expertise, I hope you will look closely at the Department of Surgery at Indiana University School of Medicine. Thank you for this opportunity to share our story with you.